Welcome back to our channel. Today we're diving into a topic that's particularly relevant during certain times of the year: hand, foot, and mouth disease, or HFMD. If you're a parent, teacher, or just someone interested in staying healthy, this video is for you. We'll be exploring the signs and symptoms of HFMD, so you know what to look out for, as well as practical tips for managing the condition at home. Plus, we'll discuss when it's important to seek medical help for yourself or your loved ones. Stay tuned as we delve into crucial questions surrounding this condition, including its duration and when it's safe for you or your child to resume daily activities like going back to school or workplace. Find out all the answers by watching the entire video. Whether you're curious about HFMD or dealing with it firsthand, stick around for valuable insights and advice. Don't forget to hit the subscribe button and turn on notifications so you never miss an update. Let's jump right in. Hand, foot, and mouth. Disease is very contagious, and outbreaks typically occur more frequently in the warmer months, particularly during the late spring, summer, and early fall. This pattern is often observed because enteroviruses, such as Coxsackie virus, which are the primary culprits behind this condition, tend to thrive in warm and humid environments. Additionally, HFMD outbreaks commonly occur in settings where large groups of young children gather, such as childcare centers, preschools, schools, and summer camps. The close proximity and frequent contact among children in these environments facilitate the spread of the virus from one child to another. Hand, foot, and mouth disease is a common viral infection, typically caused by enteroviruses such as Coxsackie virus. It primarily affects infants and young children under the age of 5, but it can also occur in older children and adults. Here's a detailed elaboration on the signs and symptoms, management, and when to seek medical help for HFMD. Signs and symptoms. Fever. HFMD often begins with a sudden onset of fever, which may be moderate to high grade. The fever may last for a few days and is usually one of the first signs of the illness. Sore throat. Children with HFMD commonly experience a sore throat, which can cause discomfort, especially while swallowing. This symptom may precede the appearance of other characteristic symptoms. Skin rash. A distinctive rash may develop, consisting of small red spots or blisters that typically appear on the palms of the hands, soles of the feet, and sometimes on the buttocks or genital area. The rash can be mildly itchy or uncomfortable. Mouth sores. Painful ulcers or blisters may emerge inside the mouth, particularly on the tongue, gums, inner cheeks, and roof of the mouth. These oral lesions can make eating and drinking challenging for children and may cause drooling. Loss of appetite. Due to the discomfort caused by mouth sores, children affected by HFMD may exhibit a decreased appetite or refuse to eat altogether. Ensuring adequate fluid intake is crucial to prevent dehydration. Irritability. Infants and young children with HFMD may become irritable, fussy, or unusually clingy due to the discomfort caused by fever, sore throat, and skin lesions. So how do we manage hand, foot, and mouth disease? As bad as it sounds, again, this is a virus infection, and that means this is self-limiting and will go away on its own. Our treatment will be symptomatic, meaning we address and treat based on presentation to relieve the symptoms while the viral infection is in an acute phase. 1. Hydration. Encourage frequent fluid intake, including water, clear fluids, oral rehydration solutions, and electrolyte drinks to prevent dehydration. Offer fluids in small, frequent amounts, especially if swallowing is painful. 2. Pain relief. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help reduce fever and alleviate discomfort associated with sore throat and mouth sores. Follow the appropriate dosage instructions based on the child's age and weight. 3. Mouth care. Provide soft, cool foods and avoid acidic, spicy, or rough-textured foods that may exacerbate mouth pain. Use topical oral analgesics or mouthwash containing lidocaine or benzocaine to temporarily numb mouth sores and ease discomfort. 4. Skin care. Keep the skin clean and dry to prevent bacterial infection of the blisters. Avoid popping or scratching the blisters, as this can increase the risk of secondary bacterial infections. Wash hands frequently with soap and water to minimize the spread of the virus. 5. Isolation. Encourage isolation of the affected child to prevent the spread of HFMD to others, especially in childcare settings or schools. Keep the child home from school or daycare until they are no longer contagious, as determined by their healthcare provider. When to seek medical help. High fever. If the child's fever persists for more than a few days despite fever-reducing medication, or if the fever is accompanied by other concerning symptoms, such as lethargy, irritability, or difficulty breathing. Dehydration. Signs of dehydration include decreased urine output, dry mouth, sunken eyes, lethargy, and increased thirst. Seek medical attention if you suspect dehydration, especially in young children who may be unable to communicate their symptoms effectively. Difficulty breathing. If the child experiences difficulty breathing, chest pain, or wheezing, seek immediate medical attention, as these symptoms may indicate a more severe respiratory complication. Neurological symptoms. While rare, HFMD can potentially lead to neurological complications, such as meningitis or encephalitis. Seek urgent medical care if the child exhibits symptoms such as severe headache, neck stiffness, confusion, seizures, or altered consciousness. As we always say, an ounce of prevention is better than a pound of cure. So here's your vitality. Vortex tips on preventing the spread of hand, foot, and mouth disease. It is crucial for maintaining public health and minimizing the impact of this contagious illness. By adhering to some simple yet effective measures, you can significantly reduce the risk of catching or transmitting HFMD. Here are some practical steps you can take. Hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds. This is especially important after certain activities such as changing diapers, using the toilet, blowing your nose, coughing, or sneezing. If soap and water are not available, use an alcohol-based hand sanitizer as an alternative. Routine hand washing. Incorporate hand washing into your daily routine, making sure to wash your hands before and after specific activities. For example, always wash your hands before preparing food or eating, and after caring for someone who is sick. To reduce the risk of contracting HFMD and spreading it to others, it's essential to practice good hygiene habits. This includes avoiding close contact with individuals who are sick, refraining from hugging or kissing someone with HFMD, and maintaining proper hand hygiene by washing hands frequently with soap and water. Teach children. Educate children about the importance of hand washing and help them develop proper hand hygiene habits. Show them how to wash their hands effectively, emphasizing the need to scrub all surfaces, including between fingers and undernails. Encourage children to wash their hands regularly, particularly after using the toilet and before meals. Care for blisters. If someone has HFMD and develops blisters, it's essential to keep them clean to prevent infection and minimize discomfort. Avoid touching or popping the blisters, as this can spread the virus to other parts of the body or to other people. Encourage affected individuals, especially children, to refrain from touching or scratching their blisters to prevent further irritation and potential infection. By following these simple yet essential guidelines, you can play a proactive role in reducing the transmission of HFMD within your community and safeguarding the health and well-being of yourself and others. As we promised, here's what you need to know about your road to recovery. Understanding the duration of hand, foot, and mouth disease, so HFMD, and when it's safe for individuals to resume their regular activities is crucial for managing the illness effectively. Duration of HFMD. Typically, HFMD lasts for about 7 to 10 days, although symptoms may persist for slightly longer in some cases. During this time, individuals may experience symptoms such as fever, sore throat, mouth sores, rash, and general discomfort. Returning to school or work. While HFMD is contagious, individuals can usually return to school or work once certain criteria are met. 1. No fever. You or your child should be fever-free for at least 24 hours without the use of fever-reducing medications such as ibuprofen or acetaminophen. 2. No uncontrolled drooling. If mouth sores are present, they should not be causing excessive drooling or discomfort that interferes with normal activities. 3. Feeling well enough. The individual should feel well enough to participate in classroom or work activities without significant discomfort or limitation. If you're unsure whether it's safe for your child to return to school, or if you have any concerns about their health status, it's essential to consult with their healthcare provider. They can provide guidance based on the severity of symptoms and the individual's overall health condition. Thanks for joining us today to learn about this important topic. If you found this video helpful, don't forget to like, share, and subscribe for more valuable content. If you have any questions or experiences to share, feel free to leave them in the comments below. Until next time, stay informed and stay healthy.